This morning, I'll be meeting with two parents who have noticed unusual bruising and nosebleeds in their child. I'll be addressing their concerns today with the clinical exam. Based on my clinical exam, the child is definitely showing signs of a bone condition, Osteogenesis Imperfecta, commonly known as brittle bone disease. I'm fairly certain we're looking at a type 1 diagnosis. Type 1 osteogenesis imperfecta involves increased risk of bone fracturing, dislocations, and possible teeth and hearing problems. I'm ordering a collagen and DNA test to get more information.
I guess we first started to think something was wrong with Colin when we would play with him, and hours later he'd have bruises.
Mr. and Mrs. Smith, the doctor is ready for you now.
I'm going to talk to you a little bit about Colin's condition and his bones and how they will develop and what you guys can expect.
Could you tell us a little bit more about what osteogenesis imperfecta is?
Osteogenesis imperfecta is a genetic disorder that affects collagen, the main building block of bones. The disorder occurs when one of two things happen. Either the body simply doesn't make enough collagen or it makes an abnormal amount of collagen. Based on the results of the collagen test that Dr. Hershey requested for me for Colin's collagen is normal, but there is about half as much as it should be, which is what differentiates him as type 1 osteogenesis imperfecta.
Dr. Hershey said something about surgery. Should we have to worry about that yet?
This is what you can expect with Colin's condition. In the future, Colin is going to have bone fractures, dislocations, and possibly scoliosis. Complications of this nature vary with type 1 osteogenesis imperfecta.
You said it's genetic. Does that mean one of us could have given this to our child?
I'm going to send you to a geneticist next. She'll be able to answer that question for you and give the results of the DNA testing. But right now it's important that both of you accept that no matter how careful you are, injuries are going to happen and that it's not either of your fault.
Good morning, I'm Dr. Holly.
Good morning.
I'm a geneticist here at the hospital, and I can explain any questions you have regarding the disorder of your child. OI is a genetic disorder. The clinical severity, features, and variation between types is caused by specific gene mutations. There are two genes that produce the proteins used to assemble the most abundant forms of collagen. Mutations of these two genes cause over 90% of all OI cases.
Do you have the results of the DNA testing?
Yes, I do. The DNA results didn't show that either of you were carriers for the disease, and approximately 25% of children born with OI have no family history of it. So in Colin's case, it was a spontaneous mutation, meaning there's nothing that you could have done to prevent it.
Okay, now is that likely to happen to a future child of ours?
No, it's not. There's no increased risk that you will ever have a second child with OI.
Good morning, I'm your psychiatrist, Dr. Grove. How are you both feeling?
Good, thanks.
Good. I understand how confusing and overwhelming it must be right now. You've been told that your child has a lifelong illness, and that can be very stressful.
Well, yeah, one minute we had a healthy boy, and now we're worried if he won't be able to live a healthy life now.
Well, I'm here to talk to you about some of the mental health concerns with your son's illness, and to assure you that although there's going to be some difficult times, the three of you can make it through this. There are 8 forms of this disorder, and your son has been diagnosed with the most common and the least severe.
What should we worry about as Colin gets older?
Well, one of the things that you're going to need to worry about is that although he'll appear quite normal to his peers, he's going to need to take precautions for the rest of his life to avoid unnecessary injuries and maintain good health. One of the other things you're going to unfortunately need to think about is OI is quite rare. People aren't likely to recognize the signs, the bruises, the fractures. So it's suggested that you carry a doctor's note with you at all times. This will alleviate legal concerns.
So he'll be able to be a normal boy?
Of course. The most important thing is to encourage an independent and active lifestyle for Colin, to encourage him to try new things and get involved.
Great, thank you.
Thank
We're
you.
still anxious, but we feel more confident after meeting with our team of doctors.
And we can just hope for the best.